Good afternoon, and thank you for joining us for this community briefing. And thank you, Margie Prop, for providing interpretation today. As you can see, I am not at City Hall today. I wish I could say that's because today is my husband Scott's and my 21st wedding anniversary, and we're off celebrating. Unfortunately, we will be celebrating this anniversary from different floors of our home. I am fine, but my husband Scott just tested positive for COVID-19. And that means that we are now following the same health guidelines that we have shared with all of you over these past 8 months. Because Scott is COVID positive, he is isolating in our basement, dealing with several typical recognizable symptoms like chills, a cough, and headache. No one else goes into the room where he is staying. Again, he's in isolation. Even though the kids and I do not have any symptoms, we are quarantining for 14 days because we live in the same household with him. In the absence of a vaccine for COVID-19, Scott's self-isolation and our 14-day quarantine at home is a key strategy for stopping the spread of the virus. By removing the opportunity to make physical contact with others until the infection is over, we stop the virus in its tracks and protect our extended family, our friends, and our neighbors. Stopping the virus in its tracks has been the focus of our local COVID-19 response throughout this pandemic. Today, we are asking everyone in our community to pay close attention so that all of us understand the sobering situation in which we find ourselves this week. Since we spoke with you at our last news conference, we received the remaining complete data for the week ending October 31st, as well as the data collected so far this week, the week ending November 7th. Our data indicates that there is now a severe risk of COVID-19 spread in Lincoln and Lancaster County, and therefore, our risk dial is moving into the red. Director Lopez will provide more details in just a moment, but first, we wish to be crystal clear about what being in red means for our community. At this level of risk for COVID-19 spread, Lincoln and Lancaster County residents should take actions to minimize contact with others wherever possible and limit activities outside the home unless for work, school, medical care, and food. Residents should wear face masks, keep 6 feet of distance from others, avoid all gatherings with anyone outside of your home, and only visit businesses that follow public health guidance. For older adults, anyone with underlying health conditions, and others at heightened risk from COVID-19, we urge you to stay home. Rely on help from others for needs outside the home, such as groceries and medications. Distance from those in your household who work outside the home, and wear a face mask around other people. What being in red boils down to is that all of us must take decisive action to get the spread of COVID-19 under control. Collectively, we have the power to flatten the curve. We know this because we've come together as a community to do it before. Now is the time, once again, to flatten the curve. I know, without even looking at the inside of my wedding ring, where my anniversary date is inscribed, that today is November 6th. The impact of the changes we begin making today to flatten the curve won't be discernible for another 2 to 3 weeks. So let's take the next 24 days, that's just over 3 weeks, and puts us at the last day of November. Let's take these next 24 days to dig deep and do what's right to protect one another and keep our healthcare system intact. Lives and livelihoods depend on all of us doing our part to move the needle back out of the red. With that, Director Lopez, over to you.
Thank you, Mayor. Today in Lincoln and Lancaster County, an additional 90 individuals have tested positive for COVID-19. The total number of lab-confirmed cases now stands at 10,545. Our total recoveries identified to date are up to 4,364. Since Sunday, we have experienced 5 additional deaths from COVID-19 in our community. That brings our total number of deaths to 50. The mayor, our health department team, and I offer our deepest condolences to all those who are mourning the loss of loved ones. As is our practice every Friday, we are here to provide you with an update on the overall level of risk for COVID-19 transmission in Lincoln and Lancaster County. As the mayor stated, for the first time, our dial risk is going to red, the highest level. This indicates the risk of COVID-19 transmission in our community is severe. Last week, we stayed in elevated orange, and we reported that most of the key indicators were high, but fairly steady. Over the past 2 weeks, many of our key indicators have reached all-time highs, pushing us quickly into red. For the past 6 weeks, the weekly increase in new cases was holding fairly steady at about 3 to 4% per week. But after our last briefing on October 30th, we received the complete data from the state for the week ending October 31st. The complete data showed that the weekly number of cases increased by nearly 40%, from 644 to 894. Those 894 new cases represent a new weekly high. So far this week, we are at 840 new cases and are on pace to exceed 900 cases this week. From October 15th through the 28th, our 7-day rolling average of new cases was in the upper 90s and low 100s. We are now averaging more than 150 cases a day. After our briefing on October 30th, we also got the final positivity rate for the week ending October 31st. It was a new high of 16.3%. From October 17th through the 31st, the weekly positivity rate increased by nearly 40%, and so far this week, our positivity rate is at 20.5%. We are also seeing all-time highs in our daily number of COVID-19 patients who are hospitalized. Since October 17th, the number of patients hospitalized with COVID-19 has nearly doubled, from 52 on the 17th to over 100 today, a new all-time high. 44 of the patients are Lancaster County residents and 56 are from other communities. 9 patients are currently on ventilators. This chart shows the daily number of COVID-19 cases and hospitalizations. The orange line represents the 7-day rolling average for new cases, and as you can see, the continued upward trajectory that we are having. The purple line represents the 7-day rolling average of hospitalizations, which also continues to increase. We are concerned for each of these patients and their families, and we are very concerned that hospitalizations will continue to increase with the upward trend of new cases. The next chart is a color gradient map we have been using to show all the indicators that are factored into the position of the risk dial. As you can see, all but one of the metrics are now in orange or red. You will find the location of the risk dial represented by the blue square outlined in red, now in the red section. Because we have moved into red, we are making changes to the local directed health measure that took effect on November 1st, last Sunday. These new requirements will go into effect this Monday, November 9th. Youth sports venues must limit spectators to no more than 25% of capacity. Indoor venues must limit spectators to no more than 2 per athlete. Also, the mask mandate now applies to all indoor buildings except residences. We also want to remind you of a change that went into effect on November 1st, and that is the mask mandate does apply to public transportation. You can view the revised directed health measure on our website at covid19.lincoln.ne.gov. In addition to the directed health measure, we have also have a set of recommendations that accompany each position on the risk dial. You will find the community guidance and recommendations just under the risk dial on the website. Red signifies a severe and uncontrolled level of COVID-19 in Lincoln and Lancaster County, meaning outbreaks are present and broad community spread exists. Here are the main recommendations. Avoid activities outside the home unless traveling for work, school, food, medical care, are to check on others who may need assistance. Only visit businesses or participate in activities that follow public health guidance. That includes mask requirements, physical distancing, and capacity limits. Furthermore, we need to limit contact with those outside of our household. All large indoor and outdoor public gatherings, as well as large family gatherings, are highly discouraged at this time. Employers are encouraged to let employees work from home if it's possible. This is the time to return to virtual religious services, takeout or no-contact deliveries, and curbside services. Older adults, those with underlying health conditions, and other populations at risk must be especially careful. Stay home, rely on help from family or friends from outside the home, and distance yourself from the household members who work outside of the home. Be diligent in following the 3 W's. Wear a mask, wash your hands, and watch your distance. Also be diligent in avoiding the 3 C's: crowded places, confined spaces, and close contact. We need everyone to understand that the actions you take today will impact the spread of the virus and the number of cases and hospitalizations we see in the next few weeks. Our collective actions together can change our current situation.
Thank you, Director Lopez. Thank you. You are absolutely right. The steps that each of us take to prevent the spread collectively add up to victory over the virus. And if we know anything about the people in this community, in this Husker Nation of ours, it's that we like to win. Winning in the fight against COVID-19 takes all of us working together to flatten the curve and keep our community safe. Today, we've invited key leaders in our community's COVID-19 response to speak about their efforts to protect lives and livelihoods and how what all of us do to help them matters. We'll hear from them in this order. First, we'll hear from Russ Gronwald, the President and CEO of Bryan Health. Second, Derek Vance, the President of CHI Health St. Elizabeth, followed by Dr. Steve Joel, Superintendent of Lincoln Public Schools, and Todd Wilchin, a Public Policy Specialist at the Lincoln Chamber of Commerce. Over to you, Russ.
Thank you, Mayor. I don't know that there's anything that we can tell you today about what to do next other than what we've already said over many months or what has been especially emphasized today, but maybe we can provide a little context around that. So if I think back to 11 days ago, on March 26th, Bryan Medical Center had 47 patients in its hospital that were COVID positive. As we fast forward now 11 days later, we have 97 patients. In 11 days, we've over doubled the number of patients that we're treating for COVID positive. We've had to take a lot of steps to accommodate that. The people are doing a great job. The nurses have all stepped up, as well as many others. We have new rooms that have been redesigned for everything that we need to do. Everybody's doing what they need to make this happen. And all of that would be great if we could see a crest in sight, but that's not what we're seeing. We're seeing today a direct straight line where every single day is a bigger problem than the day before. There's no reprieve on any day. And again, if we could see a crest at the end of that, I think it would make things a lot easier to look at. But right now, as we look around the state, and you've just seen some of these numbers, what we see is a continuation of this that creates a real problem if we don't get something done. So I'm just here to implore you what's already been said by the Mayor and Director Lopez, that we avoid confined spaces, that we wash our hands, we wear our mask, we watch our distance, and really take it seriously. So many of you are out there. When I go out, I see the number of people taking it seriously. But there's enough folks that aren't, or enough exceptions that we make for ourselves, that it's really created these problems that we're seeing. Maybe it's a Halloween party, maybe it's something else. We all have a reason for it. But nevertheless, I'm here to implore you that you do exactly what's been asked of you today, and that we take this very seriously, because it will be 2 or 3 weeks of a continued incline before we get to a crest, and that's if we take things seriously. So we're in full support of everything that the Mayor is outlining for us today. Thank you.
Good afternoon. I'm Derek Vance, President at CHI Health St. Elizabeth and Nebraska Heart Hospitals, and appreciate Russ's comments and also the opportunity to come here, Mayor and Director Lopez, and provide a little context from our hospitals as well. As was indicated, and as you're hearing, the number of hospitalized COVID-19 cases in Lincoln and across the state of Nebraska are on the rise. Nebraska's hospitals are working even more closely together the last few weeks to make sure that patients are able to get the care that they need. My system, CHI Health, right now has 209 COVID patients in all of our hospitals. 56 of them are in our intensive care units, and 18 of them are on ventilators. This morning at St. Elizabeth, we had 21 COVID patients in-house, 2 of them in the ICU, and 2 of them on ventilators. Ventilators right now are not our issue. Personal protective equipment are also not our current issue. We have strong supplies of both. We have opened up a COVID unit, actually 2 COVID units at St. Elizabeth, and have more than enough beds. Staffing those beds is our current issue. We've requested traveling nurses to supplement our current staff. Some arrived in October, others are on the way, yet to come. In the meantime, all of our staff are pulling extra shifts and working overtime to take care of patients. This week, we started limiting surgeries to free up beds in our hospitals. These are surgeries that can be held off or postponed for 12 weeks without risk to the patient. You'll be contacted directly if you need to be having your surgery rescheduled. Unless you're contacted, your surgery is still on. We also placed new restrictions in our visitor policy earlier this week. 1 healthy support person per day per patient. We are trying very hard to keep patients and staff healthy while balancing the need to receive support from family members. Additionally, CHI Health has set up a transfer center for the state. Through that transfer center, we place patients in hospitals all across Nebraska and southwest Iowa, not just within our own CHI Health hospitals. This was set up to open up beds and ensure that no single hospital in our state becomes overwhelmed. Hospital capacity in all of our facilities is monitored constantly to ensure that we have the ability to take care of our community, both those with the virus as well as anyone else who walks into our hospitals. Even without COVID-19, our Lincoln hospitals are busy. We still care for strokes, heart attacks, trauma, motor vehicle accidents, etc., every day. So what can you do? Please watch your gatherings this holiday season. A lot of COVID cases, as we know, are coming from the home. This Thanksgiving needs to be different. Please keep your gatherings small, take care of yourself and your loved ones. Please continue to mask. This continues to be the most effective method to prevent spread. Please wash your hands, use social distancing, and avoid crowds, as you've heard many, many times. We are all tired of COVID-19 and the pandemic, but now is not the time to let our guard down. The numbers are simply going the wrong direction. Finally, I just want to state how proud I am of our healthcare teams. They selflessly come to work every day. They are doing what they are called and asked to do. They are heroes and they are dedicated. But they've been at this since March and they are tired. Please help them by wearing a mask, washing your hands, and social distancing. Thank you.
Thank you, Mayor. Appreciate the opportunity, as always, to provide an LPS update. And to Derek and Russ, thank you for all the work that you're doing in our communities, and your healthcare workers they are heroes. like our teachers are, everybody's collectively trying to do the very, very best we can, and we have a lot of work to do. We understand that anxiety is high and that things change very quickly, and that's unsettling for a lot of our families. But I know that we'll continue as a community to work together to get to the other side of this, as we've spoken many, many times. LPS continues to adjust our pandemic plan in collaboration with the Lincoln Lancaster Health Department. And recently, we've required face coverings for all of our preschool students. We've required face coverings during recess. We've installed plexiglass on lunch tables. We've increased our sanitizing and disinfecting the areas where there is an identified positive case. And as recently as this week, and as recently as 30 minutes ago, we have moved identified grade levels and programs at certain buildings to remote as needs necessitate. When this happens, our staff teach students remotely while there is a shortage of staff or a number of individuals needing to quarantine. This allows us to keep as many students as possible in schools. We know that schools with high-quality safety protocols are amongst the safest places for students and adults in any given community. And we've seen this around the country and around the world. And we know that despite being in red, we can best serve this community by continuing to keep our schools open, practicing our safety protocols, and doing the best we can as a community partner. And our goal is to continuously improve. And each day we learn more about this virus. And weekly, we discuss protocols with the health department. And I want to thank Pat Lopez again for that opportunity. We had a long conversation this week, and we do every week. And LPS is committed to making changes when they are deemed necessary. And for our families, we've developed options to choose what works best for them within the safety recommendations from the health department. And at this time, I would state that our Lincoln Public Schools will continue offering in-person classes and services to students and families. We will reinforce our safety protocols and practices in schools with students and staff. We understand that this is we're in a serious mode right now that is going to require even greater work and effort on all of our parts. We are opening the remote learning request form on the website while we are in red. Families may choose now or at any time to move to 100% remote learning for their child. We would ask that you please allow time, at least 2 school days, for staff to verify the request and for teachers to get your students materials they will need. Families, I'd like to ask you, please weigh this option carefully, as continuously moving back and forth between in-person attendance and remote learning does create major disruptions in your child's learning experiences. And then finally, we will continue to work with Lincoln Lancaster Health Department to monitor COVID-19 cases in our school buildings and make decisions at the building level on any extra measures that need to be implemented. This could include moving a classroom or school to 100% remote for a period of time to address concerns. We will do our best to communicate any changes with families as soon as possible. And then one thing I did forget to say, we are working to provide more information via our dashboard. Stay tuned to our website. We've undertaken some additional study with respect to requests that we've had for information. So with that, I want to echo what both Russ and Derek said, and I know what Todd's going to say, what the mayor said, and Director Lopez said. We're all in this together. Schools are important. Everybody understands the importance of education. But if we're going to continue to be able to offer schools in a safe manner, our community has to do a better job of getting this virus under control. So we'll continue to do our part. It's our intent to maintain in-person school. We ask that everybody do their part to mitigate, stop the spread of this virus. Thank you.
First of all, Mayor, I want to thank you for your continued leadership during this pandemic. We wish you and your family, especially Scott, a speedy recovery. We also want to extend our best wishes for a speedy recovery to all those individuals who are suffering from this virus, especially their loved ones. It's not an easy time for our community. I also wanted to thank our other elected officials on the City Council, the County Board, the School Board, for their efforts working collaboratively to keep our community safe. The Lincoln Chamber very much appreciates the efforts of Director Lopez and her team at the Health Department for all their efforts working with Lincoln's business community to protect the public's health. We support your efforts to keep us safe, and we are confident that working as a team, we will get through this difficult time together. We also want to acknowledge the work of the frontline healthcare workers keeping our community safe while taking care of us and residents from across the state. Thank you. You are the unsung heroes of 2020, without a doubt. The leaders and members of the Lincoln Chamber of Commerce have obviously been very much impacted by COVID-19 and the ensuing economic disruption, and we continue to do so. The economic shutdown has left no one untouched. We realize that while raising the risk dial may be unpopular, it is the appropriate and responsible course of action given the recent increases in cases, hospitalization, and positivity rates. No one in Lincoln wants to see additional restrictions. So now, more than ever, it is important for us to take common sense measures that prevent the spread of the virus. Our Mask Up Lincoln campaign is just as important today as when we started it back in May, in partnership with the mayor's office. We are proud of the many businesses that have been taking the necessary steps to make their businesses safe and help reduce the spread of the virus. As we heard recently from Dr. Jeffrey Gold, Chancellor of UNMC, at our Face the Chamber event, quote, "We know this is a droplet spread infection. We know it has aerosol components, and we know without a fraction of a doubt that masks save lives." End of quote. If we want to keep our businesses open and our citizens working, we urge citizens and businesses to remain vigilant in wearing masks and following other protective health protocols. Thank you.
Thank you, Todd, and to everyone at the Chamber. Thank you, Dr. Joel, and to your team at LPS. Thank you, Derek and Russ, and to all the healthcare heroes who are providing emotional and spiritual as well as physical support to those in need of healing in our community. Thank you for your leadership throughout the pandemic and for all that you are doing to keep our community safe, healthy, educated, and strong. This is a powerful team. As we close today's briefing, we want to acknowledge that Veterans Day is just around the corner, and we want to express our appreciation to all of our veterans. We have several community events to celebrate Veterans Day this year, and I want to thank the organizers for presenting these events in a way that honors our veterans while preventing the spread of the virus. The third annual Lincoln Veterans Parade is set to start at 2 p.m. Sunday in the area near the state capitol, and the organizers have adapted. They've decided to make this a reverse parade, and that means that parade goers will stay in their cars and drive the parade route, which will be lined with the parade entrance. And details are still being finalized. You'll be able to find the latest information about that Veterans Day parade at lincolnveteransparade.org. The annual Veterans Day ceremony, normally held at the Auld Pavilion, will be a pre-recorded event this year. It will be aired on Veterans Day, Wednesday, November 11th at 10:30 a.m., 1 p.m., and 7 p.m. on Link TV, the city's government access channel. In addition to being on cable TV, you'll find the program on demand and on Link TV's YouTube channel at lincoln.ne.gov. It will also be shared on the Facebook page for the Veterans Memorial Garden. And with Veterans Day on our horizon, it's worthwhile to think back to another time when the people of our nation came together to defeat a common enemy. Those who helped win World War II are often referred to as the greatest generation for a reason. The courage and the sacrifice shown by our military and our allies on the battlefield will never be forgotten. We would do well to remember those on the home front during that time as well. people all across our country made major adaptations in their daily lives for the sake of the war effort. They observed blackouts on the West Coast. They adopted an extensive rationing system. They planted victory gardens and organized scrap metal drives. And many, many families made the ultimate sacrifice, sending their young people off to war, not knowing if they would ever see them again. Their sacrifices give us perspective on those we are making today to defeat an invisible enemy. We are not the first generation asked to do difficult things for the greater good, and we will not be the last. Like those we honor on Veterans Day, we who are enduring a global pandemic can be of great service to our community and our country. As we make the smart choices to protect lives and livelihoods and to prevent our healthcare system from becoming overburdened, we do so knowing that years from now, we likely will look back on this time as the moment when we acted with the greatest purpose and for the greatest good. Thank you. And with that, we'll open the briefing up for questions.
Mayor, this is Brent with. Go ahead, Riley.
Yeah, a question for Health Director Lopez. Could she explain a little bit more of the mask mandate changes and how it differentiates from where we were? And then I have a follow-up question about the directed health measure, but we could start there.
From where we were, you know what we've learned during the course of time in our investigation, and I think Todd mentioned it in his remarks too, that we have many businesses maybe that aren't open to the public, but they have staff in situations where they're not wearing masks, and we've dealt with outbreaks in those businesses. So what we've learned, especially what you've been hearing nationally, what we've been reading, some of the best practices is it's really important for everyone to be wearing a mask, especially when they're in a close environment at a conference table. We've had people in meetings not wearing a mask and maybe even possibly physically distanced, but because of the aerosolation, we really need to be wearing our masks unless we're in our own private workspace or office. So that's probably the biggest change that you're seeing. We've always encouraged people in our houses of worship to wear masks and to make sure they're physically distanced with their family, you know, keeping to their own family. So that's the main change.
A follow-up question, Director. Obviously, a lot of the recommendations that associate with going into red, staying home as much as possible, are not going to be reflected in the directed health measure changes. But could you explain, are you limited, is the health department limited in how much it can restrict activities like bar capacity with the state DHM?
No, we're not limited in what directive health measure we can apply in the city of Lincoln. So as the mayor discussed, and I was saying, you know, we're adding these other changes today with the directed health measure that went into effect on Sunday, November 1st. If we continue to see our numbers going up, we will look at other measures to put in place. That we'll constantly be evaluating that.
Director Lopez, this is Brent with Channel 8. I was going to ask a similar question, but since you just said other restrictions are possible, is there a timeline that you guys have in place that you're going to look at to evaluate if things are improving enough or if they're going in the wrong direction?
Brent, we would say, you know, anything that we put in place, we would expect about 3 weeks before we can change, hence the days we were talking about. So we would be watching that. But if we continue to double our cases in a week, obviously we're going to have to probably make other changes. It's really important for us to be able, the most important thing we can do to help our healthcare workforce and our hospitals is really the public health process of preventing spread of the disease in the community. So we will look at other measures to implement.
What would you say has been the biggest factor or factors behind the increase in COVID spread that has led up to this point? Can you point to any one thing?
Any one thing. We have a lot that are in smaller gatherings. I've talked about that a few times. We've had situations that we know where there's transmission, like you're for an event and you're in close contact, or if you're at an event where there's other activities going on, like being in close proximity at a bar or a restaurant. There's been a little bit of that, but it's primarily the smaller gatherings, a 10 or less, and it's really being with people outside your household. I think it's important to remember, too, that Lincoln is mirroring the rest of our state in what's happening, and what we've seen are huge increases in cases across the state, and that's also impacting, there's no walls around us saying that the disease can't come in here or that people aren't traveling here, maybe where they don't have the same restrictions that we put in place to protect our community. I wish there was a thing, Brent. If there was, you can believe we'd all be doing it, and I'm sure the community would too.
Director Lopez, this is Matt Olberding with the Journal-Star. I have a couple of questions specifically about the outbreak at Holmes Lake Rehabilitation Center.
Yes.
Do you have any statistics on cases and deaths related to nursing homes here in the city since the pandemic started?
Matt, I can actually send you some information. I don't want to say numbers right off the top of my head, but yes, we do know.
Okay. And was there anything unusual about that outbreak? I mean, that seems to be the biggest one we've had, at least in terms of number of people passing away. Through case investigations or anything, have you guys found any reason that happened, or anything specific about that facility?
At that facility, we were involved, but we also got the team from the Med Center, their infection control program involved in working with the Holmes Lake to set up areas where they could quarantine and isolate, put in other infection control measures. And they really done an excellent job. They are turning things around. They're almost, at the end point here. At the current time, there are no residents positive, as far as I know, right at this moment.
All right, thank you.
Mm-hmm.
Director Lopez Riley at the Journal-Star. A follow-up question that maybe could be for Dr. Joel as well, but has there been any additional school spread within LPS since those identified last week?
No, right. There hasn't been any more. We really appreciate everything our schools are doing and our educators are doing. We know that it's a hard task for them, but everything that all of our schools in this county have done has made a tremendous difference. We've learned so much since the virus first started, and knowing that our schools are a safe place for students where we haven't had spread. And that's the same across our state. And all of our health departments across the state are encouraging schools to remain open. That's something we are all very clear on in our messaging.
Mayor Riley at the Journal-Star with a question for you. First, do you have any plans to make changes within the city, go to remote working, change any city special event permits like those that were sort of planned for safe Husker celebrations coming up with this change to the grist style?
We've been in conversation with the cabinet. All of our department directors have been sort of reevaluating what they want to do with their teams. And all along, we've been trying to support remote working for those employees who have the ability to do that. But I guess I just want to here acknowledge the incredible city team. So many of the services we depend on for our water, our sewer, for our public safety, for emergency medical response, those folks don't get to stay home. They continue to suit up and step up. and show up at work day after day. And one of the reasons we're asking people to stay home, to stay safe, who have that ability, is to help protect them too. We're at a level of outbreak in our community that is severe, that is uncontrolled spread, where it is very difficult to identify the source of exposure. So we want to take these next 24 days to ask everyone to be incredibly careful, to do what they can to prevent the spread of COVID-19, to not forget those 3 W's: wear a mask, wash your hands, watch your distance, and stay home if you are able, except for going to work, school, or getting food and medicine. We will be having those conversations with different people who have requested special event permits. We'll continue to support everyone in our community to try to have things happen as safely as possible. And now that we are in the red, those conversations may shift from their end. We'll be able to report back on that when we have more details.
And then do you have a test, your own COVID test pending, or have you tested negative?
I am just currently quarantining at the recommendation of contact tracers in the health department. I have not been tested and currently don't have any symptoms. Should that change, I will get a test.
Mayor Andrew Ozaki from Channel 7 News. By the way, congratulations on your anniversary.
Thank you. My marriage is old enough to drink.
I was just wondering, we've been set here for such a long time. Are you worried that going to red really doesn't mean anything?
Yes, I'm worried because going to red is our signal. We are raising the alarm bells, and we need people to pay attention, but that's up to people. We need people to recognize that they have a stake in this. If our hospitals get overwhelmed, then there won't be enough care provided for people who need it. We all have a reason to care about our access to hospitals and medical attention when we have emergencies. We need to make sure that we are preventing illness and suffering and death in our community. We want to be able to keep our businesses open, our schools open, and everyone has a role to play in making that possible. So this is up to us, Lincoln. What path do we want for the future heading into winter? Right now, if we can ratchet things down, we'll be in a lot better position going into these harder months where we're going to be spending more time indoors, where we're experiencing more COVID fatigue and know it's hard. But we can do it. We've done it before. So let's take the next 3 weeks. Let's show this virus that we are greater than it is. It is a plea to everyone in Lincoln and Lancaster County to step up, to do their part, to make the smart choices to stay safe.
I have a question for Director Lopez. Hi, Pat, it's Riley again. When we talk about the level of uncontrolled community spread, how many outbreaks are there? Identifiable outbreaks going on, and kind of maybe where are those, or is it what? How do you compare that sort of maybe earlier May stage when we had the Smithfield plant to where we are now?
Riley, take this up. Thanks for asking that. We really, with Smithfield, it was very clear when we did our case investigation. We were able to identify the common factor. Now, you asked before about the masking and how is it different. We have identified outbreaks in businesses that are not open to the public, and so we don't report those outside of, working with that local business. So those are some of the things, that's what we've learned. But as far as the others, there's no central location that we can really point to or a central event that's happened. And we really need people to cooperate with us, answer their phone when we call, and share information, because that's what's going to really help us in the community to stop and mitigate the spread. And we have situations where, family members have gotten together and somebody's thought, well, I had a sore throat, or my granddaughter came over and she'd been having a sore throat for a couple days, but she didn't really think much of it, and then got worse the next day and went and got tested and had COVID, and yet had been at her grandparents' house that were in their 80s. So now they were exposed and have to quarantine. We have multiple stories like that we can share. Are the students working together and doing a good job of wearing their mask? And when we talk to them about, and I'm not talking about our K through 12 students, but they're together, they're playing a board game, great thing to do. But, when we ask them, did you have your mask on then? Well, no, we didn't keep it on then, So we have a lot of opportunities for education, and we take those and try to provide that as much as possible.
Is the health department planning to sort of continue its enforcement of the DHM
Yes.
sort of strategy with education and then enforcement and spot checks? I mean, is that kind of the same MO?
Yeah, thank you for asking that. Yes, we do. We're going to work on education and then pursue from there. And that seems to be extremely effective. We had an administrative review with one of our businesses this week that was really well. I think you've seen some other areas where warnings were issued and then citations were issued. But as far as the DHM now, our focus is going to be doing education and working and providing that support. We're getting a great response from the sports team, sports groups sending information in those centers where the activities are occurring. I also wanted to make a correction in our hospital numbers. I realized I had some number, it's always changing. So we actually have 118 COVID positive patients in Lincoln right now in the hospital. And then I wanted to mention that it's really important to get your flu shot. We said by Halloween, but if you haven't done it yet, please do it now as soon as possible. And try to stay away from others or stay at home until you get that shot so you have your protection. If you need a shot, and you can call the health department at 441-8065 and get a time scheduled. You can come in. They're free of charge. The only reason we're asking people to schedule appointments is we're watching our distance and wanting to keep everybody safe that's coming into the building for a vaccine, but it's really a very easy process. So please don't hesitate to call us. And our physicians know that, and they'll refer you if they're having a vaccine shortage also.
I have a question for Dr. Joel. And this is from Charlie Bergen at Care 4. Does going into red affect athletics, playoffs, and other activities?
Not in a sensitive way. We are adjusting some of our protocols in accordance, again, with conversations with the health department, but no, right now things are still on as scheduled.
I'd like to follow up on Dr. Joel's question, the question posed to Dr. Joel, and just say that what's important to realize is that as we evaluate the different risk mitigation efforts, we're playing chess, not checkers. It can be easy to think, we shouldn't have sports for youth in the K through 12. But what we're seeing is that with all the protocols that LPS has in place, with all the education, with all the training, we aren't seeing transmission happening there to date. It doesn't mean it's not possible, but we are not seeing widespread outbreaks because of sports in the schools. However, where we are seeing outbreaks, or where we are seeing transmission, I should say, in our case investigations, is when people are not at school, when they're not, when they're in their free time, the time that they have outside of the formal structured environments. So if kids aren't playing school sports, They maybe have time on their hands to hang out with their friends where it's more tempting to pull down the mask to be in close contact, because that is human nature to want to be close to one another. So again, just to back up LPS on their decisions, want to make sure that people understand that those are being thought through. Those decisions are thoughtful and thought through. Any other questions? Okay, well, thank you so much for tuning into this important briefing. Please remember to follow the 3 W's, to wash your hands, watch your distance, and wear your mask. Avoid the 3 C's, crowded places, confined spaces, and close contact. This is more important than ever. Please stay home to stay safe, with the exception of going to work, to school, to get medicine or food. Let's take the next 24 days to get this under control for our community, for our people, for our lives and livelihoods. Thank you.